Hi, I'm CHURN from the Harbours Medical Practice, and this is a video about chronic pain. And I think it's the hardest video that we've tried to make. I think any video about chronic pain should really start with an apology, because I think that the way that healthcare professionals have tried to help people with chronic pain has caused a lot of harm. We used to talk about a painkiller ladder where we would give you more and more and more painkillers until finally we got on top of the pain, and that would make things better. And I think, unfortunately, that's caused a lot of people a lot of harm, and I'm really sorry about that. I think the other thing I'm really sorry for is that I'm not sure that even now we know the best way to help people with chronic pain. So if you've got pain and you're watching this video, I think it might be quite hard to watch, but hopefully there's something in here that might help you, and in the future hopefully we'll have some better treatments to help you with your pain. Well, it'd be pretty naive to think that everyone watching this who's taking painkillers regularly is taking them purely to numb a physical pain. And I guess the question I'd ask is, does it really matter whether you're taking them to numb a physical pain or an emotional pain? I think you end up with a very similar problem, and hopefully some of the things that we're going to talk about will be just as helpful no matter the cause of your pain. Well, why does the treatment start to cause more harm than good? Well, a big part of it is that the medication stops being so effective at reducing the pain, and it might even start amplifying the pain and making it even worse. On top of that, you continue to accumulate risk from taking the medication and to get an increasing array of side effects. And these side effects can be really slow to develop and hard to recognize. It could just be a growing sense of tiredness and fatigue, or worse than that, they can start to affect your mood. And if your mood gets worse, that also starts making the pain worse. It's a horrible, vicious circle to be in. An important concept to understand is that pain doesn't accurately reflect damage to the tissues of our body. Pain is a sensation produced by our brain really to protect us. And if you've got chronic, severe pain, the best way to think about it is probably that your brain has become a little bit overprotective. It's looking to avoid anything that might cause pain, often because that initial stimulus, the thing that caused the pain in the first place, was so bad. So if your brain has become overprotective and those pain signals have become too loud, well, how do you turn down that thermostat? Well, really the only way of recalibrating the system is to start by moving more again. And you may need to start incredibly small, just by walking more, and then gently moving into other forms of exercise. Perhaps things like yoga and Pilates with a qualified teacher can start to relearn the movements that you can and can't do. So how are you going to reduce your medication? Well, really, you just need to take it very slowly, a step and a step at a time. And every time you take a step down in medication, you need to be prepared that the pain is going to increase for a bit and then hopefully settle down to a new level. And then eventually you might be ready to think about a life without any medication at all, but still with the pain. When you've had severe pain for a long time, it can start to rob you of your sense of who you are. You can lose your job, your friends, your family, and you can start to be defined by the pain itself. It's a horrible situation to be in. Sometimes the best way to try and cope is to carve out a new identity for yourself, something that you can do with the level of pain that you've got, and find a new sense of purpose. It's incredibly hard and it can take a long time. If you've got severe pain that's lasted a long time, it feels really unfair. and it is. But we're increasingly aware of the concept of post-traumatic growth. And that's the awareness that as often as bad things follow traumatic events, so can good things. So if you've got pain, well, what's that pain going to teach you about yourself? Because often bad things don't happen to us, they happen for us. So how can that inform your life and your new sense of purpose? Well, it is New Year's Day 2021 and I'm a little bit hungover and my knee is very sore. The thing is that those pain signals are exactly the same as if you were getting pain from an osteoarthritic knee or an arthritic back. But how I feel about that pain is really different. I'm causing that pain and I know that it's doing me good. So if you have pain because of something bad that's happened to you, whether it's a car crash or an operation that hasn't gone so well, whatever it is, how you feel about that pain can make a big difference, because I know that really no matter the cause of that pain, being active, moving around is going to make a really big positive improvement. So try and remember that when you're pushing on through the pain. Here we go. I think it's helpful to think of pain as a bit like the weather. There's a feeling when you're in severe pain that it's just going to get worse and worse and worse. But it isn't always the case. Pain can get better as well as worse. And it's often as changeable as the weather. So when the pain is severe or the weather is terrible, sometimes the best thing that you can do is just to wait, to batten down the hatches, to survive and hope that the weather's going to change soon and the pain is going to improve, because it usually does. You hear a lot about gratitude these days, and it's not a term that comes very easy. I think what it's about is just really consciously telling yourself about things to be grateful for. Like living in a place where the fishermen decorate their boats with fairy lights at Christmas. Well, what's good in your life and what can you seize on despite the pain that you're in? Well, I'm really grateful to you for even considering watching this video, and I'm very aware that some of the concepts here may seem a little bit flimsy and esoteric, and if you've got severe pain, the thought about reducing your medication must seem faintly ridiculous and maybe even a bit insulting. But I'm really convinced that if you have got chronic pain, then the best way to try and improve your quality of life is to try and find the courage and the bravery to even think about moving away from medication and embracing other things that might help your pain. I really hope that your pain gets better in the future.